So this patient Chandrakala, she is a 49-year-old from Siddipet. Actually, she came with a diagnosis already done outside of ascending aorta aneurysm. Ascending aorta aneurysm means the aorta which comes out of the heart. It's a main vessel which comes out of the heart. It is dilated, is ballooned out. It's almost double the size of the aorta. Means normally it is about 2.5 to 3 centimeter, but in her case almost like 6 centimeters. When we saw the 2D echo, we realized it's almost bigger than the size of the heart. So that much ballooned out aorta, and it was occupying whole of the cavity. So the problem with this is suddenly it can rupture. It's ballooned out, thinned out. So any time that can rupture, causing sudden cardiac arrest. That's one bad thing about any aneurysms. That too with a big aneurysm. And that has caused one more problem to her. That aortic root, from where the aorta is originating, that root is dilated. When that root gets dilated, what happens is there's a valve, aortic valve sitting there. That aortic valve starts leaking. We call it as aortic regurgitation. We have 3 issues now, not only 2. So only with aortic regurgitation plus LV dysfunction, that's a heart muscle not contracting well. These 2 itself is a risk factor for any surgery. But with all these 3, the surgical risk increases to almost like 10 to 15%. But there is no other choice other than doing operation. We have to take a risk and do. She is a young lady, has a only son at home. Husband expired. Correct. So it was a challenging situation. Her brothers helped her to do this major surgery. We counseled with the patient party, and we took a long time to arrange the things, because it's a major surgery. We need to arrange few things like a grafted conduit and with the valve, a special graft material that we procured, and we did the surgery 7 days back. This is post-op day 7. So actually surgery took almost like 6 hours. This expected 6 to 7 hours. Not much blood loss which is expected, but didn't happen after surgery. Her recovery was fantastic, because we could take out the ventilator on the same day of surgery. Same evening we took out the ventilator, and second day she walked, and within 2 days she was out of the ICU, and she is in the ward, and she is doing well. She is walking around and eating well. Most probably she is about to be discharged today or tomorrow. She is fine. Alamma, ठीक है माँ? हाँ, अच्छा है ना? अच्छा है. Okay, all right. Okay. The most challenging thing in this surgery is, see, when there is a new aorta formation in the form of graft, so there are 2 coronary arteries coming out of any aorta. Left side one, that's called left main coronary artery, and right side one, right side coronary artery. So these 2 coronary arteries have to be replaced to the new graft material. That's a new aorta. So we have to make a button out of these 2 coronary arteries, separate it, dissect it nicely without any kink or anything, and put it in a position where after the blood starts flowing, after the heart starts contracting, that should flow nicely without any disturbance into these 2 coronary arteries. That's the most challenging thing. Plus, when you do all this, when you attach a graft material, that's made of an artificial cloth-like material. When it gets attached to the normal tissue, there is always a chance that it can bleed. So bleeding is one of the most challenging things, complications, which surgeons come across during this Bentall's operation, which we could manage properly in this scenario.
Namaskaram andi. Na peru Chandrakala. నేను సిద్దిపేట నుండి వచ్చాను. నాకు గత 14 ఏళ్ళ నుండి ఇవాళ సమస్య ఉంది. మా బ్రదర్ ఇక్కడ ఉంటాడు. తన సార్ గురించి తెలుసుకొని ఇక్కడికి తీసుకొచ్చాడు. సార్ వాళ్ళ టీం చాలా బాగా నాకు సపోర్ట్ చేశారు. సర్జరీ కూడా చాలా బాగా అయింది. డాక్టర్ నిసర్గా సార్ ప్లస్ వాళ్ళ టీం చాలా బాగా ఇచ్చేశారు. వాళ్ళకి వాళ్ళ టీం అందరికీ ధన్యవాదాలు.